How to interpret borderline GERD diagnostic tests. Have you ever received a borderline result on a gastroesophageal reflux disease diagnostic test and felt confused about what it means? You are not alone. Understanding these results can be tricky, but let's break it down together. First, it's essential to know that diagnosing gastroesophageal reflux disease is not always straightforward. It often relies on a mix of symptoms, test results, and how well treatments work. Borderline results indicate that findings are not clearly normal or abnormal, making interpretation a bit more complex. Let's look at some common tests used for gastroesophageal reflux disease. An upper endoscopy, also known as esophageal duodenoscopy, allows doctors to see the lining of your esophagus and stomach. This test can identify inflammation or other issues. However, many people with gastroesophageal reflux disease have normal endoscopy results, which does not rule out the condition. Another important test is esophageal pH monitoring, which measures acid exposure in your esophagus for 24 hours. This test can show both acidic and non-acidic reflux. If your pH results are borderline, it may indicate acid exposure close to the abnormal threshold but not quite above it. Esophageal manometry is another test that checks how well your esophagus is working. It looks at the function of the lower esophageal sphincter, which can play a role in reflux. There are also other tests that assess the resistance of the esophageal lining, which may be lower in gastroesophageal reflux disease. When you receive borderline results, it's important to correlate your symptoms with the test findings. For example, if your acid exposure time is borderline but you experience clear symptoms, this could indicate a connection. Doctors often use symptom association probability calculations to help understand this relationship. Additionally, considering other metrics can be helpful. Newer measurements like baseline impedance can provide extra evidence of reflux-related changes, even if acid exposure is borderline. Evaluating how well you respond to treatment is also key. A trial of proton pump inhibitors can help clarify your diagnosis. If your symptoms improve significantly, it may support a gastroesophageal reflux disease diagnosis, even if tests are inconclusive. It's also vital to rule out other conditions that might mimic gastroesophageal reflux disease symptoms. Conditions like functional heartburn or eosinophilic esophagitis can present similarly, so excluding these is essential. Using a comprehensive approach can help. The Lyon consensus framework suggests combining multiple test results and clinical data for a more accurate categorization. This recognizes that no single test is perfect, and gastroesophageal reflux disease can show up in various ways. For patients with borderline test results, doctors usually review symptom patterns carefully. They may analyze symptom reflux associations from pH impedance studies and consider additional testing if needed. Monitoring your response to acid suppression therapy is also common. This layered interpretation helps guide personalized treatment decisions. It balances evidence from borderline tests with clinical judgment and your experience. Follow-up and possibly repeat testing may be necessary if symptoms persist or worsen. In essence, interpreting borderline gastroesophageal reflux disease diagnostic tests involves integrating test data with symptom correlation, additional measurements, and treatment response. This approach acknowledges that diagnosing gastroesophageal reflux disease is multifactorial and benefits from a tailored evaluation strategy.